Hi and welcome back to Movies Explained, where we recap your favorite movies for you. Today we will be recapping The Good Nurse, a crime-filled thriller that will remind you to have your one apple a day to keep the doctor away. So without further ado, let's begin. A discordant beeping with the initiation of code blue signifies the opening scene. The medical staff immediately starts resuscitating the patient. The nurse and doctors eventually use the defibrillator to save the patient, while Charles Cullen, a nurse at the hospital, stands close by and watches the effort with a helpless expression. The patient passes away and the time of death is marked while Charlie walks away. Amy Luffren, a nurse at Parkfield Hospital, fixes up the IV line of an old woman, Ana Martinez, whose husband is sitting at her bedside. She lets the husband stay for the night with her against hospital rules because Ana is anxious and doesn't want him to leave. Amy is called in by the administrative officer and scolded for letting a relative sleep over. She also informs Amy that she has hired someone to help her with night shifts. Amy experiences a sharp pain while she is trying to change a comatose patient's position to prevent bed sores. She retreats to an empty room to breathe and let the pain subside. Later, she gets a follow-up and her doctor informs her that if she continues like this, she is liable to suffer from a serious coronary accident which might be fatal. He also informs her that she requires a heart transplant as soon as possible and her children should be informed of stroke symptoms in case it happens at home. He advises her bed rest and a leave from work, but Amy argues that she doesn't get health insurance until she's at the hospital for another 4 months and she will have to wait. Back at work, she runs into Charlie, the new hire at her hospital. She gives him a hospital tour and shows him the ropes. They talk about previous work experiences and Amy learns that her old colleague and friend Lori was also once Charlie's colleague. They check up on Ana, who is assigned to Charlie for the night. Charlie helps her drink water. Later, after being done with their assigned patients, Charlie and Amy eat dinner together and talk about work and family. It is revealed that both of them have 2 daughters and are single parents. At home, Amy's daughter is arguing with the babysitter when Amy walks in. Amy apologizes to her for not being able to give her much, but her daughter tells her that she doesn't even have her mother because of her busy schedule. At work, Amy experiences crushing chest pain again when she's trying to switch the position of her patient. She goes aside to help herself breathe when Charlie walks in and asks if she is okay. Amy is struggling to breathe and sweating profusely when Charlie sits beside her to allay her anxiety. She tells him that she has cardiomyopathy and she doesn't get health insurance for 4 months. She asks him to keep it a secret or else she will lose her job, and Charlie promises to help her through. He offers her his jacket because she is cold and tells her she is going to be okay. On another work day, Charlie drives Amy to the hospital when they are told that Ana Martinez has passed away with her cause of death unknown. They go to her room to clean her up for her body to be sent home when Charlie confesses to Amy that his mother went through the same and that is his last memory of his. Amy goes outside to speak to Mr. Martinez and console him. 7 weeks later, 2 detectives, Braun and Baldwin, arrive at the hospital to investigate the suspicious death of Ana. They are called by the hospital board to follow the necessary protocols to close the case. The medical board explains to them that they believe Ana passed away due to an adverse reaction to medications. They are also informed that she passed away 7 weeks ago and her family was not informed about the unusual circumstances of her death. The detectives ask for the list of medications and for her body to gather further evidence, but it is revealed that she has been cremated. Charlie helps Amy's 9-year-old daughter Alex prepare for an audition. She is doubtful about it, but Charlie boosts her confidence and urges her to get the part. At the station, Braun and Baldwin are working on the investigation when they find out that Charlie has previously had a trespass charge in Pennsylvania about 8 years ago. At the hospital staff is gathered and informed that due to a suspicious death, they will be interviewed by the local police and advised to cooperate. Braun and Baldwin are furious over the settlement of a hospital representative's presence in the interviews but agree to it eventually. Amy is called in for the interview by Braun and Baldwin. At one point during the interview, the hospital representative is called outside. Braun sees it as an opportunity to ask about Ana's reports and Amy comments that the decreased C-peptide levels suggest that she was given insulin from an outside source. The representative comes back inside the room and Braun asks Amy about Charlie. Amy tells him that Charlie can't be involved in something like this and that Ana died on a day shift when Charlie only works night shifts with her. She reassures them that Charlie is an excellent nurse. Another patient at the hospital collapses and Amy's heart acts up when she is giving chest compressions to the patient. Breathless and in pain, Amy leaves the scene. Charlie gives her medication from the hospital and Amy argues that he will get fired if someone finds out. He reassures her that there is a glitch in the system that won't register the medication he has just given her and will be disguised as a cancellation. He takes her to the doctor and urges her to tell her elder daughter about her illness in case he's not there to help her with it. Later, Charles and Amy educate Alex about the disease together to help Alex understand. Braun and Baldwin call up all the hospitals Charlie previously worked in to gather more information about him. Most of his former employers refuse to give out any information about him, leading them to a dead end. Braun and Baldwin receive the internal investigation files from the hospital. Baldwin is furious over the fact that the hospital is withholding information and confronts the hospital representative about it while screaming at her. Baldwin and Braun are banned from the hospital, but Baldwin informs Braun that Anna had both digoxin and insulin in her system when she passed away. Amy is doing her regular checkups on her night shift when she notices that Kelly is not well oriented in her demeanor and notices that her pupils are fixed. The alarm bells go off in her head and she calls her husband immediately. She gets Kelly's blood work report and realizes that there is insulin in her system. Simultaneously, a code blue is initiated and the hospital staff rushes to Kelly's room to resuscitate her, but unfortunately, Kelly passes away. When her husband shows up holding her newborn daughter, Amy breaks the bad news to him and he breaks down crying. Amy and Charlie watch the scene. Braun and Baldwin show up at Amy's house when Amy tells them she doesn't know what happened to Kelly. They catch up on the fact that there was another victim. She tells them she can't talk to them when her kids are around. They question her about Charlie and tell her that they have called 9 hospitals and none of them are cooperating to give out any information on him. They hand her their contact details and leave. Amy calls up to meet her old friend and colleague Lori. She asks him about Charlie when Lori tells her that there was a rumor about him that he overdosed someone with insulin and when he left they stopped getting frequent code blues. She also tells her the hospital would find pinpricks in 4 bags in the store. Amy rushes to the hospital store and checks the 4 bags in the store to find one of them pricked. This confirms her suspicion, but she faints. When she wakes up, she finds Charlie nearby and is repelled by him. She tells Charlie she wants to leave immediately, and he helps her out of bed to drive home. The next day, Amy goes to the police station to talk to Baldwin and Braun and fills them up on her recent discovery. Braun and Baldwin ask her if the source can testify in court and she tells them that she can't. They further tell them that they need a body for an autopsy to prove that the drugs insulin and digoxin were in the victim's body when they passed away. Amy leads them to Kelly's house and Kelly's husband agrees to do the exhumation of her remains. At the hospital, Amy prints out the drug request forms under Charlie's name from the hospital computer. Most of them are cancellations for digoxin and insulin. She takes the evidence to the police and they tell her that cancellation doesn't prove anything, but she tells them that it's a glitch in the system as the drug is retrieved on last-minute cancellation and yet it doesn't register in the system. At the hospital, the head and attorney meet up with Charlie and fire him on grounds of providing false information regarding his previous employment. Charlie looks heartbroken yet signs the papers anyway. Later, at night when Amy gets back to her house, she sees Charlie spending time with her daughters while also cooking something in the kitchen. She is appalled yet doesn't show it to Charlie. She asks her daughters Alex and Maya to leave the room so she can talk to Charlie alone. She tells him she feels sorry for what happened to him today and he talks about how he won't be at the hospital to help her anymore. He mentions how his ex-wife made up a story about poisoning her dog and now doesn't let him see his daughters. Amy tells him that Alex is going through a rough patch because of everything that is going on and she needs to be alone with her daughters to help Alex better and bond with them. Charlie tells her that he understands that and he will be there for her and leave. As he drives away, Amy stifles a gasp and sobs. The next day, Amy calls Charlie while Braun and Baldwin record and listen to the conversation. Amy apologizes to him for last night and reassures her that it's okay and that she needed time with her daughters. She goes on about how she is going to miss him at work and Charlie suggests a meetup. Amy tells him to meet up with him at lunch on the following Saturday and they say goodbye. After the call, Baldwin tells Amy that the only way to get him to stop killing more people is to make him confess to the deaths. On Saturday, Amy waits at a restaurant for Charlie to show up while having a microphone on her so Braun and Baldwin can hear their conversation. Through the microphone, they can hear her heartbeat racing before having the encounter. Charlie arrives wearing scrubs and they greet each other by hugging. He tells her he likes the place Amy decided upon. They place their order when Charlie tells her that he is starting a new job tonight at another hospital. He tells her that he has all his things in his car and is ready for a new start. He asks her about her daughters and she tells them they're all right. She further tells him that work has been hectic without him around and they were a very good team. She also tells him that everyone is talking badly behind his back and it makes her angry that he can't defend himself. She tells him that she argued with everyone at the hospital regarding that. Charlie tells her that he doesn't want to talk about the hospital and she questions if it is because what they are saying about him is true. She tells him that she doesn't care if he did those things because she understands, but Charlie snaps when she reaches out for his hand. A few moments pass and Charlie breaks the silence, telling her that he got permission to see his daughters and he was thinking if both he and her family could go on a road trip. Amy insists that she wants to talk to him about the hospital and what he did there. Charlie takes a deep breath and tells her that he has to go and leaves. Amy informs the officers that he is leaving. They come in and ask her where the new hospital that hired Charlie is. Braun makes a call to the nearest police station to arrest Charlie when he goes there and informs them that they can only keep him for 48 hours if he doesn't confess. On his way to the hospital, he is stopped by the police and arrested. He cooperates with them and is taken to a police station where Braun and Baldwin arrive to question him. They ask him about the number of 4 bags he tampered with in the last hospital he was working at and tell him that they know he killed Anna and Kelly. He tells them he can't talk about patients without hospital lawyers, but they tell him that he doesn't work there anymore so he is free to say anything. They question his motives for killing the people he killed, but Charlie doesn't confess to anything and gets hysterical. Braun informs Amy that he is not confessing and they will have to release him the next day. Amy drives to the police station and asks to meet Charlie. Braun instructs her that she can't get close to him or touch him through the encounter and they can only talk in his presence. Amy comforts Charlie and reminds him of how good and generous he has been to her and it baffles her how he could do anything like this. Charlie cracks and asks her what she wants him to do, to which she answers that she needs him to tell the truth. He tells her he just did it, and upon asking why he tells her because they didn't stop him. He lists a few names and Amy holds his hand through it. Charlie pleads guilty to murdering 29 people and gets 18 consecutive life sentences. Amy gets the heart transplant she needed and thrives to live on and see her grandchildren. The recap ends here. Thanks for watching, and if you liked it then remember to like the video and subscribe to our channel. Also let us know what you think of our work as we are willing to improve further on the quality for you all. We will see you in the next one.